The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hello folks, today on Aging Horizons we'll be talking about Medicare and CHIP, two of my favorite subjects. We'll have with us the resource manager from Missoula Aging Services, Kate Kottner, who's going to tell us how it works in her neck of the woods. You know, we've been having lots of CHIP counselors on lately, and we just want to give you a little idea how it works around the state. So stay with us, we have a lot to tell you about.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local CHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Receiving help for Ella has been life-changing, and the best word for it is relief. I was the therapist, I was the aide, and I couldn't be the mom because emotionally you're just to your wits' end, you're trying to survive.
I provide care for the Harrises, specifically their daughter Ella. Respite care is extremely challenging, but the rewards that you receive from it are 100 times more than working with a child that doesn't have special needs. Once they get something, it's everything. It's a you celebrate. You don't just enjoy those moments. You celebrate every moment that you get, that you guided them to that next step.
Respite. It's okay to need it. It's okay to want it. Will you provide it? Call 800-224-6034 or visit respite.mt.gov.
It went from survival to enjoying life and being able to be a mom again.
Brought to you by the Montana Broadcasters and this station.
Hello everyone and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Kimmy Everman, and as I said in the open, we're going to be talking about my favorite stuff today. No, not food, Medicare and CHIP. It's so important to understand your Medicare benefits and to know where to turn if you need assistance. So as part of our bringing you CHIP counselors from around the state here on Aging Horizons, we have with us today Kate Kottner, who's out of the Missoula Aging Services. Kate, welcome.
Thank you. Yeah.
And Kate, you are the resource program manager at Missoula Aging Services, which really just means you do lots of different things, correct? Tell us a little bit about what you do.
Okay, yeah, it's true. I do a lot of different things. And the first thing I want to tell you this morning is that I'm really happy to be a part of the team at Missoula Aging Services, where we promote the independence, dignity, and health of older adults and those who care for them. And so in the Resource Center, that's the focus of our work. And CHIP is a big part of that. All of the staff in the Resource Center are CHIP counselors. And then we're also an Aging and Disabilities Resource Center. And that means that we help people with a variety of needs. We do one-on-one appointments for Medicare, Medicaid, for caregivers who just need to talk to someone. We do caregiver consultations, and we do benefit screenings to help people see what programs and services they may be eligible for.
Yeah, so the good news is always that if you come to see a CHIP counselor or talk to one, you're also getting the advantage of finding out if there are other services available that might be something that would make your life easier or better. And also, to just clarify, you don't have to be a senior citizen to come to Missoula Aging Services for assistance. You can also be an adult with a disability, and that's what that ADRC part is.
That's absolutely true.
Right.
Yep.
So let's sort of talk about SHIP. As I said, my favorite subject. We talk about it a lot here because it's so darn important that people are able to navigate through some really difficult waters sometimes. So that's really what a SHIP counselor does. Tell us a bit about that.
So SHIP stands for State Health Insurance Assistance Program, and that means that we provide unbiased, no-cost assistance, education, and support for people to understand their Medicare and to work through difficulties possibly with their Medicare, because Medicare is really complicated. So we do that in a variety of ways. We teach Medicare classes, new to Medicare classes. We do one-on-one appointments all year long to help people understand and navigate their Medicare. Right. And then we do, of course, a lot of Medicare appointments to compare and switch plans during open enrollment.
Which is going on right now. It just started a couple of weeks ago, and it's a pretty important time of year for Medicare beneficiaries. Kate, why is that?
Well, it's a Medicare beneficiary's chance each year to compare their plan and compare different plans and look at the plan that might serve them the best for the coming year. And so people on Medicare can't switch plans all the time. Mm-hmm. And Medicare open enrollment is the chance for people with a Medicare drug plan or Part D or a Medicare Advantage plan to shop for and compare their plan and get into the plan that's going to serve them well for the coming year.
Yeah. Well, Kate, let me ask this question then. Say I'm a Medicare beneficiary and I really love my Part D plan. Can I just stay in it? Not do anything during open enrollment?
You can sure just stay in it, but you want to make sure that your Part D plan is going to have the same coverages and benefits next year that it had this year. If you don't do anything, it will just roll over, but some of the costs or benefits may change. And so if you meet with a SHIP counselor during open enrollment, you can really look at the details of that plan and what it will look like for the next year. And if you still like what it's going to look like, you can stay with it. Mm-hmm. Or if you find one that might be better, you can switch. So it's good to compare.
Yeah, I think that's absolutely right on. And we just have about a minute left. Let's talk quickly, Kate, about what a person needs to gather up in terms of information for open enrollment.
Oh, that's a great question, Kimmy. And what we need for plan comparison appointments is your Medicare card, any other plan card you may have, any other insurance card you may have. We like either a really current detailed list of your medications, or even bring your medications with you in a Ziploc bag to the appointment so we can make sure we really verify what your medications are. And then, we can help.
Yeah. And at that point, it's really just, again, that comparison process. And at the end of that, the person is going to choose for themselves what they want. Right?
That's absolutely true. We provide unbiased support, but it's very, very important that a person's decisions that they make about Medicare and about their health care are their decisions.
Yeah. Okay, folks, we're running out of time, but we'll be right back. Stay with us.
With as many as 1 in 10 Americans at risk for Alzheimer's or some other form of dementia, chances are someone you know and love will receive that diagnosis. When that happens, you may well feel devastated, but know that you are not alone. Help is available. You don't have to face dementia by yourself. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
It's been 27 years. I never thought I'd still be smoking, but here I am, COPD and all. I'm about to have a granddaughter. There's so much to show her, but I'm scared I won't be able to keep up like I used to. I kind of gave up on myself on quitting. But it's different now. I want to be here for her and for my daughter.
When I stopped showing up, Jim showed up at my door. He took me to the hospital in town to get me help. That's the day Jim saved my life.
Everyone has a role to play in preventing suicide. Know the signs and don't be afraid to speak up. If someone you know is in crisis or emotional distress, the only wrong thing to say is nothing at all. Call 800-273-TALK or text MT to 741-741.
Every generation produces heroes, men and women who step forward to defend our country in time of need, no matter the personal cost to themselves. And though we can never fully repay them, we can make sure they have access to low-cost, long-term care when they need it. That's what Montana's Veterans Homes are all about. If you've got a hero in need in your family, call us. We can help.
Hi everyone, welcome back to Aging Horizons. We're here talking about Medicare and SHIP today with Kate Kottner out of the Missoula Aging Services. Kate, we're so glad to have you.
I'm so happy to be here, Kimmy.
So let's talk a little bit more about open enrollment, just because it's such a big thing. In terms of getting assistance for that, we want people to call early and get an appointment, right?
Yes, please. We get SHIP counselors across the state get really full, and their time is limited, of course, during Medicare open enrollment. And so getting your appointment scheduled early is really important.
So what we'll do is run our 1-800 number on the screen right now, and that way, folks, all you have to do is call the 1-800 number and it'll roll you into the agency that serves your community, and you can find out that way how to get yourself an appointment. So yeah, let's make sure that we are real clear about that, because they get very busy, don't they?
Very busy. We do open enrollment appointments pretty much back to back 5 days a week, all through open enrollment. So
Wow. Well,
breaks, but not much.
and we're committed to making sure that people get the best information that they need in time to make those comparisons before the deadline is up. So, and another thing that we want to talk about, Kate, is some of the helping programs that we have available that are sort of made for Medicare, but some other stuff too. Can you talk a little bit about those helping programs?
Absolutely. So there are a couple things that come to mind. One is a program called Extra Help. It's also known as LIS, or Low Income Subsidy, but that's a program that people can apply for that helps them with their Medicare Part D drug costs, so their prescription drug costs, and it can help with premiums, co-pays, deductibles, and there are income guidelines for those programs, but they can be really helpful to those who qualify. And another great thing about Extra Help is that it also gives the people who are eligible an extra chance each quarter. If they happen to need to switch their plan, they're able to do that, so they don't have to wait until open enrollment.
Wow, that's a huge benefit.
It is, yep. And then another program that we can help people apply for is called MSP, and that stands for Medicare Savings Program. And it also has income eligibility guidelines, but it can help with Medicare premiums for Part B.
Right.
And then also, in some cases, it can help pay deductibles, co-pays, and co-insurance for Medicare costs. So it's a really important and wonderful program as well.
Well, and I always say about these two specifically, these are hand-ups, not handouts. These are programs that exist because folks on fixed incomes need them, and they've worked and paid taxes their entire lives to deserve them. So not a handout.
Absolutely. I absolutely agree with you, and they are a huge help to people. So.
And what about Big Sky RX? Because that's always one of my favorites.
Oh, yes. Big Sky RX is another wonderful program, and it's through the state of Montana. The name kind of indicates that. Yeah, but it can pay up to that year's average Part D premium cost in a premium for people who qualify. So it just can help with the premium cost of the Medicare Part D plan. So that's really great too.
And the nice thing about Big Sky RX is that the eligibility is a little bit less stringent than some of our other programs that are available. So people that may not be used to getting any assistance might actually be eligible for something like that. So it's really important, folks, to look into it. And in order to look into it, you just need to call a SHIP counselor, right, Kate?
That's right. That's what we're here for.
And all they need to do is, we'll put the number on the screen again, the 1-800 number. All they need to do is call and ask for a SHIP counselor, and you can either answer their questions or get them to the right person.
We can do that.
Well, and as we talked about off camera, it's a no wrong door. Anybody who comes, we will try to help you get to where you need to be.
Absolutely right. And that comes back to us being a resource center too. I mean, SHIP counselors do that, but also at the Aging and Disabilities Resource Center, it's definitely a no wrong door approach. And that's what we do, is guide people to what might help them.
Right. Well, and I'm so glad that we had a chance to talk about open enrollment, although it's already started. People need to know that that is going on, and to take advantage of it if they can, and to just compare that plan just for the heck of it, just to make sure it's what you need for the next year.
Absolutely. Please come and see us.
Okay. Well, folks, we've talked a lot about open enrollment here today. Very important time for Medicare beneficiaries. Very, very important time for them to compare, to see what things might cost next year, and then just talk to a SHIP counselor and get some objective, unbiased sort of feedback as to what you're looking at, and then choose yourself. We have a whole lot more we're going to talk about. Don't go anywhere. We want you to stay with us, so we'll be right back.
I was diagnosed with diabetes in 1992, and I went into denial. It made me angry. I was a professional chef, and I didn't want to change my eating style. It took me a long time to get serious about managing my health. My perspective changed from resentment to one of loving my body, the container for my spirit. Getting help from my diabetes educator supported my goals of improved self-care. I want to feel good and have a great life. My diabetes educator helps me do this.
If the Aging Network in Montana was a restaurant, the sign out front would say, over 50 million meals served over the last 30 years. Since adequate nutrition is critical to health and quality of life, nutrition services are an important factor in keeping older Montanans healthy, independent, and living in their community and home. To find out more about senior nutrition programs in your area, call 1-800-551-3191.
In 20 years at an electric utility, I've seen the hardships many of our neighbors face with high winter heating bills.
Ross Holter, Flathead Electric Co-op.
That's why I donate to Energy Share of Montana. I just hate the thought of senior citizens, and young kids especially, being cold in the winter. Donate to Energy Share. Help your neighbor stay warm.
To donate, call 888-779-7589 or go to EnergyShareMT.com. Energy Share, you can help your neighbor stay warm.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Hi everyone, welcome back to Aging Horizons. We're talking about Medicare and SHIP today with Kate Kottner from the Missoula Aging Services. But we also have some more information that we want to give you about Missoula Aging Services. They got a lot going on, and if you live in that area, you might want to check them out. Kate, welcome back. Glad to have you.
I'm so happy to be here.
So Kate, tell us a little bit, about what MAS is doing, because I know they always have lots of moving parts and lots of programs and resources going on.
So we do have a lot going on. We have many programs. Like you said earlier, Kimmy, It really is a no wrong door approach at Missoula Aging Services. And I'll just tell you a few of the programs that we have. We have a nutrition program that provides Meals on Wheels, yes, and congregate meals to people in the Missoula area. And we have volunteer services with tons of great volunteer opportunities. We have an education program where we provide a lot of classes and workshops for people in the community. Of course, we have the Resource Center, which is where I am, and we are an ADRC. And then we have veteran-directed care, in-home services, care management. We have a money management program. So we've got a lot going on.
Wow, that is amazing. So is the best way for someone to tap into that just to give you guys a call?
So we have a call center, and it's one number to reach anybody you need at Missoula Aging Services. You just call 728-7682, and our wonderful staff in the call center will answer questions and direct you where you need to go within the agency. And it's just a great system for us.
Right. And let's just jump back really briefly to Meals on Wheels and congregate meals, because I know, especially during COVID, that may have been interrupted, and we know that a lot of folks who use those services, it's for socialization as well as nutrition. How's that been going?
It's been going great, actually, and COVID did have an effect on the congregate meals where people got together, of course. But as far as Meals on Wheels, our Meals on Wheels program actually really expanded during the pandemic. And it was a lifesaver to so many people, because not only does Meals on Wheels provide a nutritious meal, but it also is a friendly face and someone to check in with the person. In our delivery drivers, our volunteer delivery drivers are wonderful, and they really did a huge job during the pandemic and continue to do it.
Yeah, and they are dedicated, good folk, those volunteer drivers. They would do almost anything to get that meal to the person. And I think they also really enjoy the social interaction with the folks. At least that's what I always hear from the volunteers, is that they really like that interaction. So let's also talk about, because in our first segment you mentioned that Medicaid might be something that you could help with, but let's clarify how, I mean, you're not a Medicaid agency, but let's clarify what can happen if someone needs that with your help.
Yeah. So we can help people apply for Medicaid. We do help people with a lot of applications in the Resource Center. And another huge thing that we help people with is the transition from Medicaid to Medicare or Medicare and Medicaid. You can have both. And that can be a very confusing time for people, and we help them work through that.
Boy, that is a true statement. That can be really, really difficult to navigate. So you can help somebody apply, and you help apply for lots of different programs. And then you can work with that person, especially with the Medicaid, just to go through the process and make sure that things are going along as they should, right? But you don't make the decisions.
That's absolutely right. We provide unbiased support and education for these programs, but it's super important that people make their own decisions and that what is important to them is honored. And that's really what we do at Missoula Aging Services.
Well, that's certainly what I would want as a consumer, to be treated that way. So that's really good to hear, Kate. So we've talked about lots of the programs that you do there at Missoula Aging Service. We talked about open enrollment coming up, or in open enrollment, and we know that folks need to make appointments early and get some assistance. Anything else that you wanted to say about MAS today, Missoula Aging Services, that folks should know?
One other thing that is new this year that I'm really excited about is that we have a new partnership with the University of Montana Pharmacy School, and we are going to be offering medication review appointments during open enrollment. And that's so important because there's a lot of medication interactions and sometimes they don't get caught. And so the licensed pharmacists at the UM Pharmacy School, along with some of their students, will be providing these appointments to our clients, and we're thrilled.
That's fabulous news, Kate. I mean, I can't think of something that wouldn't be that's so important. Kate, thanks so much for being with us today. We have enjoyed talking to you and really are glad that you're there in Missoula. Thanks so much.
I was happy to be here today, Kimmy.
And folks, we just want you to give a call, reach out, and you can get some great assistance and support. For Aging Horizons, I'm Kimmy Everman.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.